Thank you for joining us again for this special report on COVID-19 with Dr. Gary Lewis. In this episode, we share what we know about the coronavirus as of late March 2020. Also, Dr. Lewis shares some recommendations around products that may boost your immune system. Dr. Gary Lewis is a medical officer for the North Shore Health Department, a family practice physician, co-owner of the Thiensville Health Alliance, and member of the Thiensville-Mequon Chamber of Commerce and Business Association.
Good afternoon, ladies and gentlemen. So we're back again. It feels like several weeks ago since we just sat here, but in fact it was only last Sunday. So we have the latest update for you on this viral epidemic. We have 30 cases of proven positive cases on the North Shore. There are 9 recovered from those 30 cases, and in fact there were about 354 cases tested and deemed to be suspect cases, of which the 30 were positive. Indeed, the North Shore Health Department is working like crazy to keep pace with this epidemic, and as the medical officer for the North Shore Health Department, we get the latest information. So let me start with a couple questions and get to some updates from where we sat last week. And I think these are the questions that are on the forefront again of what people would really like to know. The first one is, what makes this coronavirus most different from other viruses or from recent infections that we've had? So firstly, this is because this is a respiratory viral infection that is very easily spread, and it is very much the same as the flu. It spreads from person to person with a high degree of morbidity and mortality. So what does that mean? The flu infection, if we look at it, has a 0.1% mortality rate. That is what we've become accustomed to each year. Now with this viral infection, we jump to a 1% mortality rate, which makes everyone very nervous and very wary of this virus. It's very devastating for certain population groups. Number one, the elderly and people with underlying medical conditions such as diabetes, heart disease, or asthma, any lung condition. So there we have it in a nutshell. The second question is, how is it caught? People want to know how susceptible I am if I walk past somebody and I touch somebody. There are so many questions out there. Basically, it's a human-to-human transmission process. How long is it in the air? Does it stay in the air? Basically, in a nutshell, it's spread with sneezing and coughing. So it's spread via droplet spread as well as aerosol spread, meaning the aerosol spread is if you cough or sneeze, it kind of hangs around in the air for a little while, and people pick it up on being in the same environment. That is the lesser of the two spreads. The worst one is the droplet spread, which is if you cough and sneeze and the virus kind of rests on a surface, and it's very it has a tendency to hang around on surfaces such as plastic and steel. Hence, if you open a door after someone's been in the room and you touch the handle, even 15 minutes or so, you get an infection, or the infection is on your person, and you become susceptible. Now, if we look at it, it's several hours before it becomes basically a non-entity. So you're looking at a very infectious period where people are susceptible to this virus. So handshaking is the key. Stay away from handshaking. Do not touch people on the clothing. You can elbow bump if you want to say hi, but be careful of touching doorknobs, things like that. Wash your hands frequently. Let's jump on to the third question, which is testing. Is this available, and should we be tested? Anybody who has signs and symptoms, is this available to be readily tested? And the answer is no. This is basically reserved for higher suspect cases, people who have very likelihood of having the disease, which unfortunately represents the tip of the iceberg, probably in regards to this viral infection. So so the testing kits and availability is not very accessible, is the bottom line. Are the young people immune? We know that it does have a propensity for the elderly, people with underlying conditions. But people say, well, I'm young, am I immune? Is it less severe if I get it? The answer is yes, it is less severe. However, there are cases where people who have somewhat compromised immune systems, even though you may be middle-aged, younger, and you can pick up the infection. Now, the problem with picking up an infection in a young person is that, again, you spread it to the next person. It goes from person to person, and eventually that person may contact an elderly person or someone more susceptible, and thereafter it's spread. So people who have, grandparents who look after little kids or have contact with the families, things like that. That's why there's this whole play on isolation and social distancing, and especially the quarantine of the nursing homes and the like. Is there a cure for this virus? Have they come up with anything that's an antidote? The answer again is no. At this point, according to the infectious disease profile in the country, no, there's no antidotes, there's no cure that you can go and basically get treatment for. There are things that are being researched and as we speak, and the problem with things that may have a benefit for curing this virus are also associated with side effects and toxicity. So at this point we want to basically make symptomatic treatment the first key, as well as isolation. And in talking about that, I would like to say that although there is no cure, I do have a couple of things that you can help to boost the immune system with, and this is readily available at our pharmacy, which is Welltopia Pharmacy, which is in the Thiensville Health Alliance building. The products which essentially are most suited for improving your immune system is this one, first of all, Sufficiency C. Now you take 2 grams of this substance probably twice a day. You break it up. It boosts the immune system. It helps with all your immune responders and is probably the single most important item to be aware of. The next one to take is definitely a probiotic, something like orthobiotic, which is also available and helps to boost your immune system. Just looking at the products that we have over here, zinc is a very effective immune booster, and this high concentration of zinc and zinc product is again highly recommended as a daily dose. Looking at K-Force, which is a vitamin D as well as vitamin K, also an immune booster and recommended by Welltopia Pharmacy. If you have any lung problems, coughing, things like that, this combination, it's a homeopathic product called Breathe Free from Rootology. Again, very important and very beneficial to expanding the lungs and helping with any respiratory problems. Cytoquel helps with the cytokine immune system, which is basically inflamed when you have a viral infection. Active, so you want to basically have an anti-inflammatory product that will quell the inflammation. This thing has curcumin, N-acetylcysteine, and other products which would help as an anti-inflammatory. And again, we have a very good homeopathic, non-medicated cough and bronchial syrup with any signs of cough. Just moving on to the last couple questions that we would pop up for people at this point. Reinfection and immunity. If you are infected, is there a possibility that you can get reinfected once you've recovered, or how does that work with recovery? The answer is At this point, we don't know because the viral is so new and there are not many cases of re-exposure to or reinfection once you've had the disease. However, according to previous viral infections such as the flu, once you've had the infection, you develop antibodies which basically build up in your system, and on re-exposure, there is no, you are protected from recurrent infection, such as viral vaccines is the premise behind that. So I believe this should behave in pretty much the similar way as previous viral infections. So when we look at the sort of cycle of this viral infection, what are we looking at? Are we looking at, is this going to hang around till next spring, or what is the cycle or the time that's predicted? When are we going to be free to get back to whatever it is we get back to? Now, according to Dr. Farsi, who is the infectious disease specialist of basically of the US and a very well-known and respected ID specialist, he believes that there are cycles, and going according to the cycles that have taken place in China and where the other countries, Italy, that this viral has gone through its whole metamorphosis, it's basically been about 8 to 10 weeks. If we look at each country and each basically state, which is represented as a country in terms of size, really, it depends on the demographics as well as the kinetics of the virus, and depends on where in the cycle we have landed. So in terms of the cycle of this, we're looking at perhaps a couple to 3 months before it turns around, but again, it's very hard to predict at this point. We haven't reached a plateau yet, we haven't stabilized, and again we're back to our prevention and social distancing and quarantine and all those kinds of things. So thanks for listening, and in wrapping up, I'd like to just leave you with a couple of pointers that you can take home with, and hopefully this has given you a little bit more information. Kind of like as I finished off last week, and pretty much the take-home message would be that it's very ironical, the fact that this viral invasion has made us quarantine and isolate socially. The distancing and the separation of individuals in a symbolic sense has actually brought us closer together as a community. People have put aside their differences and for the most part have expressed compassion, help, and action, which has really reinforced the social networking foundation. The message is that we're all in this together, we need each other, and we basically are very much stronger together. So we have to remember that in the rush to return what we perceive as normal, in the rush to get back to that, we need to use this time to really consider which parts of normal are really worth rushing back to. So thank you for your time, and we really appreciate you taking the time to view this video. Please call our office for further and more specific questions about the disease, and also information about treatment and therapies for improvement of your immune systems. The number to reach would be 262-242-3369, and also look out for us on Facebook as well. Thank you.